Welcome to Ask the Good Doctor. I'm Dr. LaJoyce Brookshire, and welcome to Ask the Good Doctor Live. I am so glad that you could join us today right here on my YouTube channel, And please, if you could, subscribe to my YouTube channel. Yes, Ask the Good Doctor, LaJoyce Brookshire. Like, comment, and subscribe. Thank you. I am so glad that you are here with us today. And of course, it is Inauguration Day. And guess what? My vice president is a Black woman. Oh, love that. And in the spirit of Kamala today, I am wearing my pearls and my green. And I'm not AKA, but I am Alpha Sigma Tau, and we wear green also. So congratulations, Madam Vice President. And congratulations, President Biden. Yay! Biden era. We thank you. We welcome you. We're ready for change. Yes, we are. One of the things that we want to have a conversation with you today, I want you to grab your Good Doctor notebook, because you are not going to want to miss a minute of this. I know I always say that, but I'm serious. You are not going to want to miss a minute of this. And in my promo for this show, I said that we are talking about the hottest topic of the day, and it ain't the inauguration. And we are having a conversation with a nurse practitioner. We are. But first, I want to tell you about the Wellness Warriors Weekend Getaway. If you would like to join us in Vermont, we are going to have an awesome time, and we'll talk more about that later. I'll show you. Yes, we're having 2 wonderful weekends in June for safety, of course, and only 40 people per weekend. 40 people, and we are half booked in each weekend. And if you'd like to join us, get on it fast. Send me an email at drbrookshire@outlook.com. That's drbrookshire@outlook.com. So the time is here. Grab a notebook, and I'd like to welcome our guest all the way from Michigan. Her name is Tamika Morrow. Hello, Tamika. Thank you so much for joining us.
Hello, Dr. Brookshire. Thank you so much for having me.
Listen, I'm sorry I had to track you down, okay? I literally...
That's okay.
I had to stalk her because she put out a Facebook post that was so incredibly riveting. I just had to invite her here personally to tell you one-on-one, and you can ask her questions live about what she's speaking on regarding the safety and the efficacy of the COVID vaccine. So thank you for joining us. Can you tell us a little bit about your background as a nurse practitioner?
Sure. So I'm a nurse practitioner, been practicing internal medicine for over 12 years now, majority spent in primary care, all aspects of primary care, from the office to rounding in the hospitals, nursing homes, you name it, primary care, I've done it. So that's where I've been. And then I would say maybe about 4 or 5 years ago or so, I always had this passion to help heal people. Before, when I first started, I was, into the whole diabetes arena, because so many people were experiencing complications associated with diabetes that was totally unnecessary, like the amputations and going blind and, renal failure. So I was very focused on that. But what I noticed in the traditional primary care setting, having to see 30 plus patients a day, it didn't allow me the opportunity to really focus in on bringing health and wellness to my patients. So I ventured off and started with Synergy Health and Wellness. And the amazing thing is I was just focused still, however, I was still straight traditional medicine. And I was just following all the guidelines, doing what we were supposed to do. And I had this one particular patient come in where we, termed it pre-diabetic. So blood sugar's not high enough to get the diagnosis of diabetes, but they were higher than normal and trending that direction. So I went the standard medical approach, told her I'll see her in 6 months. And if she's not any better, come back and I'll start her on medication. But when the patient left, at that moment, I felt in my spirit that I failed my patient.
Mm.
And I was like, Lord, what is this about? And he's like, you're waiting for her to get sick. And he's like, patients don't have to be sick. People don't have to be sick. And I'm like, do tell, tell me more. And so that's when he opened my eyes to holistic wellness and started talking about the leaves of the trees and the herb yielding fruit and it just everything that he's provided. He said he's given us everything pertaining to life and godliness. And so that began my whole transition into functional medicine, and started doing post-grad studies at the Institute of Functional Medicine as well as Functional Medicine University. And I've been implementing functional medicine practices, and I have actually seen not only patients prevent complications such as amputations and going blind and, going on dialysis, but actually reversing diabetes altogether, where that diagnosis is no longer named amongst them, the medication no longer named amongst them, and people are walking in that God-ordained life that Jesus died for us to have. So that's where I stand today.
Amen. And in your work as a nurse practitioner, certainly your patients are either coming to you for the vaccine or asking you your opinion of it. What say you, Ms. Tamika?
My patients already know me. They said, I would just ask, but I already know what you're going to say. So I am totally against my patients taking the coronavirus vaccine, 100% hands down.
Why? You said 100% hands down. And you also said you are against your patients, plural, taking the vaccine. So you mean everyone?
Everyone.
No matter. Talk to us.
No matter. So first of all, there's a lot of different components. First of all, if we look at our own natural immune system and we just look at the numbers, right? According to CDC, it's so funny after my video went off, some of this data they removed, so you can't go and find it. But whatever. But according to CDC, majority, over 99% of people with our own natural immune systems recover from coronavirus. So your own natural immunity gives you greater than a 99% chance of recovery. However, if we look at the vaccines, you have Moderna, which gives a 94.1% efficacy rate. So 94.1%. So that's the thing. People think if they get the vaccine, then they won't get coronavirus. That's inaccurate. People, even through the clinical trials who receive the vaccine, still end up getting infected with coronavirus. Then Pfizer was funny because initially they had a lower efficacy rate. Then when Moderna came out with 94.1%, they came back and said, oh, well, we got a 95% efficacy rate. But if you still look at both of those rates, one is 94.1, one is 95%, it still does not measure up to the greater than 99% our own natural immune system gives in recovery.
Let me ask you this question.
Go ahead.
How much pushback have you received from peers as well as patients who are still clamoring? Because I believe that one of the reasons this went to Operation Warp Speed in the first place was to satisfy a screaming public. Give me. I want the magic bullet.
Well, I would. So in regards to the first question, the pushback, majority of my patients don't push back because we have established a patient-provider relationship where they trust what I say because they know I have their best interest at heart. And then, of course, I also, put other things in place to boost their immune system to give them some protection. So even when the coronavirus first came out, I think I only had maybe 2 or 3 patients that ended up getting infected out the whole practice. And then we got 2 office locations. And one was a nurse in the ICU that was working with coronavirus patients. But even when she was exposed, I mean, her symptoms were so mild, like she didn't even think she had it. So that's one element. In regards to peers, I mean, I actually have a lot of peers who are more in support of my position, but they're afraid to just say it out loud. But then you do have those other peers who don't think for themselves and kind of just go along with whatever CDC and NIH puts out there. But on the other element, when you talk about the warp speed, mRNA vaccines, they've been playing with those at least, I would say, 5 years. So the whole mRNA thought wasn't new. It didn't evolve in 2020. They've been playing with that for a few years, and they've been doing it in clinical trials, but the trials been stopping for all different reasons.
That's right.
So it's not actually a new concept that occurred in 2019 or 2020. And even the coronavirus is not new.
Right.
FYI, coronavirus has been here for some time, and even a common cold is caused by a form of a coronavirus, just
Coronavirus.
FYI.
Absolutely.
But part of the issue is with what we see today, and this is my injecture, is what I feel. Dr. Fauci, he's been studying coronavirus for some years.
Mm-hmm.
And it's this called a gain of function research that they were doing. And what they do is manipulate different viruses. And the whole thought behind it is that if a pandemic was to ever occur, and someone used it as global or biological or chemical warfare, we would know how to respond. So in the United States, when they were studying, President Obama initially was funding the studies and the research, but then you had over 200 scientists pull out because they thought it was unethical. And they said one misstep could cause a global pandemic.
Ha.
So Obama shut the research funding down. Fauci still wanted to continue. When President Trump took over, he started again. It got shut down again. So Fauci took it over to the Wuhan lab. So now we see where we are today. So the coronavirus isn't new. And even before, when SARS-CoV-1 was out, that was the early 2000s.
Yes.
They were actually doing studies at that time to try to produce a vaccine for coronavirus. That time, they didn't bypass the animal trials. So they started with the animal trials. They used these ferrets. And what they found from that study is that when the ferrets were exposed in the wild to the coronavirus, it became lethal. Like a lot of them died. So they shut down the studies and they concluded that this is not going to be safe to use in humans. And then they also said that they didn't think a good vaccine would be effective because of the type of pathogen it is. It's considered a zoonotic pathogen, which means it can go from animals to humans and vice versa. So it was shut down at that point in time. And so now we're here today. Like I said, this Operation Warp Speed wasn't really a warp speed. They've been working on this for some time. That's just my thoughts. I mean, when you look at all the information, the Bible said God gives us the Holy Spirit, that'll lead us and guide us into all truth. And I do believe that this is some truth that he's allowed me to see.
Okay. And one of the things that you said, that really the first thing that you said that caught my interest on your Facebook post was that the truth about the vaccine is that it has a technology that has never been used before.
Correct.
Say more.
So they're using what they call, so typically old vaccines, they use, you get exposed to a part of the virus where there is a small amount of a live virus or the dead part of the virus, but you're still getting exposed to part of the virus to elicit immune response. But this time they're using what they call messenger RNA. And what messenger RNA is, what they tell us is that there's none of the virus in it, but messenger RNA is going to basically send a message to your body to produce these spike proteins. The spike proteins is one of the characteristic features of the coronavirus. So the hope is once your body produces these spike proteins, your immune system will elicit a response and produce antibodies to attack it because it's recognizing it as foreign. The issue that I had with that is just thinking about what autoimmune disease is. Autoimmune disease is when the body doesn't recognize itself and it attacks itself.
That's right. And
so when we look at the standpoint of how this vaccine works, what they noticed with the vaccine is that the antibodies weren't sticking around for a very long time. So that's the reason why you had to get 2 injections initially. But because it's not sticking around, they said you're going to have to keep doing this every year. So that right there became a ding ding concern because now you're going to be training your immune system to start attacking something that your own body now is producing. And once you get to that point, so much immune pathology can take place where now your body don't know what to attack. It don't know what to do. And that right there is part of my concern. So it's like for people to risk these complications and potential complications and ignore the fact that your own healthy immune system give you a greater than 99% chance of recovery, it doesn't make sense to me.
Yes. Well, the first thing that's problematic is you use the word technology.
Right.
Hello, somebody. Why are we using technology in a vaccine? Exactly. Technology is for inanimate objects, not humans.
Exactly.
I am floored that it's allowed. I am dismayed at the medical establishment. I know that we're smarter than this. I listen, if you could see me shaking my fist, I know that we're smarter than this, than to come up with something That's technology to be inserted. Yeah, she said it's
Woo.
people of profit.
Mm-hmm.
Remember
It
that
is.
dude, Offit, Paul Offit for Profit? With
Mm-mm.
the whole that, oh, that's some vaccine history.
Really?
But but
That's what it's
but
all profit.
it's been. But
Mm-hmm.
I digress. Now let me just say this: if you want to take this vaccine, if you
Mm-hmm.
are insisting that you have this vaccine, if this conversation does not in any way sway you, I want to say investigate for yourselves. But
Right.
I will tell you that information is being snatched off of their own
Yes.
websites faster than you can say Timbuktu. Because
Yes.
I personally clipped the a clip that said it was aborted fetal cell tissues
Mm-hmm.
used in it.
Yep.
And when I went back to that clip, that page
It's
was
not there.
not there.
Mm-hmm.
And they took that down because they knew that it would be an out for people who had a
Mm-hmm.
morality issue
Yes.
against it. Against it.
Mm-hmm.
I saw it, read it with my own two eyes,
Mm-hmm.
clipped the HTTPS, put it
Mm-hmm.
in my email for
Mm-hmm.
safekeeping, and
Yes.
I should have copied the entire page.
Yep. Yep.
And it's
Same.
not there.
Mhm.
Right?
Yep, same thing. Even with the medication hydroxychloroquine, that study, they did that study back when SARS-CoV-1 was out. And it showed that it was not only effective in treating coronavirus if given early, as well as preventing. You cannot find that study anywhere. They done buried it so deep. You can go to the search engine where all the medical journals are. You cannot find it
That's
at
right.
all whatsoever.
See, I love her because she said that. Yes. Just like that. I do that. We're passionate about helping people.
Yes.
Only people who clap when they talk are passionate. Okay?
Right. There you
When they
go.
speak. Listen, that's right. Give it so. I'm going to tell you, though,
Mm-hmm.
that the hydrochloroquine, it actually works. And why does it? Because it's antiviral.
Mm-hmm.
Okay. And it's an immune booster, it's immunotherapy. And the other one is ivermectin.
Ivermectin. Yes. Studies have
Okay.
been phenomenal with
Li-
ivermectin.
Listen,
Outstanding.
they testified in front of Congress. One
Yes.
doctor testified in front of Congress on behalf of
Yes.
ivermectin as a prophylactic, meaning a
Yes.
preventative, just like a
Exactly.
condom is a prophylactic.
Exactly.
It is a prophylactic. And he said, I know that we have something that's tangible. The
Mm-hmm.
one thing, though, the issue that I push back a little bit on hydrochloroquine is even though it's effective, number one, it takes away from the people who do use it, like people I know who have
Mm-hmm.
autoimmune diseases really, really
Mm-hmm.
intensely that supply. Additionally, my medical doctor, who's also my alternative therapy doctor, my
Mm-hmm.
greatest teacher, Dr. Frederick Douglass Burton, he
Mm-hmm.
said he has always shied away from uh, the Paquinil because, which is hydrochloroquine,
Mm-hmm.
because one of the major side effects is it causes blindness.
Right. But so the thing is, you're only on it to treat coronavirus for
Yeah.
5 days. It's
Okay.
a 5-day treatment. A 5-day treatment is not going to lead to blindness. The blindness takes place with people who's on it long term.
Yes.
The
Yes.
other element is for preventative, the preventative dose is only one dose every 2 weeks. So
Oh
you're
wow.
not getting that much to cause any significant side effects, including the blindness. And
Mm-hmm.
then the whole element of taking away from people with autoimmune disease, that's a crock as well, too. Because there's so many other treatments out here for autoimmune disease. The Plaquenil is not the only treatment. So that whole thing is hogwash.
True.
That's how, and even with the ivermectin, it was so funny. Like after Dr. Corey came and did that presentation before Congress, next thing you know, FDA started putting a whole bunch of stuff off, talking about don't believe this is a drug used for animals, and you don't want to. And I'm sitting there like, are you kidding me? They've been humans this way for decades. But people who don't know, they'll read that and think it's facts when it's not. It's manipulated data. Is it using animals? Yes.
Yes.
But it's
Yes.
manipulated data. It's been using humans for decades.
Listen, the point is well stated that
Mm-hmm.
99% of the people who contract COVID recover.
Right.
So then these large numbers that are being reported as COVID are what? Nurse to me.
You're so funny. Do you want me to go there or you want me to be nice? What you
Nope,
want me to do?
I want you to stand in all of your truth.
Okay, so standing in all of my truth, I believe some people who did have chronic morbidities, who were more at risk, like the elderly, those with respiratory situations like asthma, COPD, chronic bronchitis. I mean, they're at high risk for anything, whether it's coronavirus, the common cold, or the flu. I mean, even to the standpoint that guidelines, when we have a patient who has asthma or COPD, when they get the cold, we have to prophylactically treat them with antibiotics so it won't turn into a pneumonia. So you have that anyway. But another factor that contributed to the deaths being the way it is because of the fact that they changed the standards of care. So in my eyes, it was murder. It was genocide at its finest, because they already knew that if you put somebody on a ventilator, they only have maybe a 10% chance of coming off successfully. They knew that going into it. Ventilators cause trauma to the lungs.
Yep.
Ventilators also increase your risk of pneumonia and sepsis, which is infection throughout the body. And this was a known thing. What they were telling the hospitalists at that time was, you can't use other normal standards of oxygen therapy, such as a nasal cannula or like a BiPAP or a non-rebreather. The thought was you'll put the aerosols out into the air and spread coronavirus throughout the hospital. So that's what they were saying. So people who could have benefited just from regular nasal cannula oxygen through the nose, just that easy. They said that option wasn't available and they had to send everybody onto a ventilator. So they put people on ventilators knowing doggone well they wouldn't come back. Oh. And then on top of it, the other thing that they were doing is not coding people. So that coding means to go into a code blue. So if someone's heart was to stop or they would stop breathing, you do resuscitation efforts. They stopped that for sake of aerosolizing the air, and maybe spreading the infection. So people who could have been rescued through CPR, that option was not given to them. And they also overrode that patient's decision on how they wanted that to take place. They made decisions and made that decision on who should live and who should die. The other thing is they withheld treatment that we know works. And instead of giving treatment that we know works, what they start doing is utilizing experimental drugs on the patients in the hospital. So that remdesivir, that's new. Remdesivir ain't been around that long. That's new. And they put it in the standards of care of treating these patients. And you saw people's livers just getting shot. Okay. And then it wasn't even any significant difference. I was reading one study with the remdesivir. They took maybe the ICU days, instead of being 13 days, to 11.6 days. That's not even significant. And so it's like, but people are in there struggling, trying to live. So they're just dumping all this experimental stuff. It's like one big, huge experiment.
It is a petri dish. Let me say this.
It's terrible.
When they started tossing around that remdesivir, I said, it's going to be years, maybe even sooner than that before the studies are released. But the fallout from it is going to be, if these patients get their hands on someone like us, who could say, time to clean your liver, time to detoxify that blood, time to do all of these things. The walk back from it. We have a question. Rose is asking, my mother's in the hospital for COVID and they want to give her plasma therapy. What do you know about this?
So that's new too. That's a new therapy. Once again, they're using on people. So from what I've read so far about it, people have been improving with it. If the plasma is the antibody treatment, the monoclonal antibodies that they've been giving people have been improving. But like I said, it's all new and it's all experimental. So yeah.
Okay. All right.
That's all I can say about it.
We're going to take a little break.
Okay.
And on the other side of the break, I want you to talk about, we're going to bust down the myths of vaccines, not just COVID vaccine, but the vaccine period. Okay. And I want you to give us your testimony about what happened to you obtaining a vaccine in a pharmacy. So don't go away.
Get me in trouble. All right.
When we come back, more on Ask the Good Doctor right after this. Hi there. Thank you for joining me. I am at the Essex Culinary Resort and Spa, and I am in a therapy room where you can come and get pampered and get hands laid on you. I had the most amazing massage the other day. It was just totally awesome. Listen, they curate all kinds of things special just for you. Peppermint, hot stone, maple syrup. We are in the land of maple syrup. So won't you join us for the Wellness Warriors Weekend Getaway, June 2021. I'll be here. I want you to be here too. Don't miss it. Oh, these are all of the beautiful things on the ceiling at the formal restaurant at the Junction at the Essex Culinary Resort and Spa. Right here, this is the chef's table where you can sit and have an incredible meal. I am here to tell you that the Essex Culinary Resort and Spa has the most amazing restaurants. The food is farm to table, and it is fabulous. So join us for the Wellness Warriors Weekend Getaway in June 2021. Hi there, we are at the outdoor pool at the Essex. Look at this wonderful waterfall. You stand under this, and this is like, oh my gosh, it's exfoliating. Wonderful. What a beautiful poolside to sit at the Essex Culinary Resort and Spa. Don't miss it. We'll be here for the Wellness Warriors Weekend Getaway, June 2021. I'll be here. Join me.
Nice.
Welcome back to Ask the Good Doctor. I'm Dr. LaJoyce Brookshire, joined with nurse practitioner Tamika Morrow, who has gone viral with a Facebook post that she did concerning the negative effects, in her opinion, of the vaccine. I have to always keep it as these are our opinions, okay? And she is just sharing with us today what she believes are the facts. And now we're going to go to some of the myths. And one of them is, Tamika, one of the myths. People believe that this, first of all, is a savior. We know there's only one, but one savior.
Exactly.
And this vaccine, they believe that it will cure everything.
Mm-mm.
I have a problem with that.
Right.
Because a vaccine doesn't cure anything. Just because you get your flu shot or just because you get a chickenpox vaccine, it does not mean that you cannot contract the flu or chickenpox.
Right.
So actually, after you get a COVID vaccine, or if you choose to, you need to be equally as safe. That doesn't mean you can take off your mask. That doesn't mean you can social distance, that you can stop social distancing. And I think that's one of the really big myths. And then there are the myths that there are, people say that there are medicines, there are no medicines that can help you.
Yeah, that's a lie.
Right. So is hydroxychloroquine your go-to?
Actually, we can't use it. We got a letter from our licensing board in the state of Michigan saying that they will take administrative action against our license if we prescribe it.
Wow.
Someone like me who wanted to care about my patients was still doing it initially. So then they sent us another letter, say they empowered the pharmacists not to fill our prescriptions. And if pharmacists filled our prescriptions, they would take administrative action against the pharmacist license as well as our license. So at that point, we were locked and we could not prescribe it because pharmacists were afraid to dispense it.
Oh my goodness.
I know. So that's another reason why you shouldn't trust this vaccine. When they're going to those levels, it's just unbelievable.
Wait, let me put my side eye on that.
Ooh,
Okay.
yeah.
What?
Yes.
That sounds like medical malfeasance.
Seriously.
Okay.
It seems like something should be able to happen, but I'm waiting on the justice.
If people choose to get the vaccine, if they are choosing to, where should they do it? Because I know pharmacists are saying come into our pharmacies. In fact, I was of the mindset that if you're going to get the vaccine, please do so in your doctor's office where they can recognize the adverse effects. And you need to be within 10 minutes by ambulance to a hospital. You must. Additionally, that I always say, well, don't do it in a pharmacy because it's not necessarily a clean environment. And, pharmacists, they push those pills, even though they're a pharmacist enlightened me, and we're going to have him on to have this discussion, and he's been specially trained to administer these vaccines. How do you feel about that?
I agree with you, that when people go, if they choose to, I hope you don't. But if you choose to, I wouldn't go to necessarily a pharmacy to have it done. Doing it at your provider's office, or, they've been doing it at the hospitals, you can do it that way. Just because, it's not what the pharmacist is usually trained to do and what they do on a regular basis. So you can have issues that take place with that.
Okay. And you have a testimony about something that happened at pharmacy.
Dr. LaJoyce. Yeah, once when I was working as a hospitalist, they were enforcing that we had to have the flu vaccine. So this was a couple years ago. And so I went to the pharmacy to have it done. And because it was a poor injection quality, how they injected the vaccine into my arm, I ended up with what you call adhesive capsulitis. And adhesive capsulitis is something that can happen if it's injected wrong. So that's what happened. I had to go through a long time of physical therapy and until God completely healed me from it. But that was a journey.
Woo. Okay. Well, let's talk about all of the wonderful things that you can do, that you recommend to for keeping yourself safe, to avoid preventive measures. What do you recommend other than the prophylactics?
Other than the prophylactics, it's a lot of things. Immune system function, we think about immunity, majority of our immune system originate in our gut. So I like this thing. They said you are what you eat. You can eat yourself to life or you can eat yourself to death. So to boost your immune system, really, really changing how you eat is very important. One of the things I recommend people do is stay away from dairy. Dairy is not our friends. I always look at it from the standpoint, if we look at how God designed our bodies, majority of us between the ages of 3 to 5, we stop producing the lactase necessary to even break down the dairy. So if you think, if God wanted dairy in our bodies, he would have gave us what we needed to continue to break it down and digest it, but it's not there. So one of the things we know about dairy is very, very pro-inflammatory. Dairy also increases your mucus production as well, which can make you more susceptible to respiratory infections. So that's one thing I always tell people. The other thing I say is start reading your food labels.
Yes.
When you look at the food labels, anything with like high fructose corn syrup, artificial colors, artificial flavors, that stuff will jack your gut up. So staying away from those is another thing that's very important. All the excess sugar, staying away from excess sugar. You see that in like sodas and juices and, whatever else that you eat, desserts, cookies. But something else I recommend too is making sure you're drinking plenty of water. Water is very important. The goal should be about half your body weight a day. So you can do that calculation. I ain't gonna put nobody out here, but half your body weight a day in water is recommended as well too. Another thing that I say is getting out of fear. Fear, when you have a lot of fear on board, the Bible said fear hath torment, but fear also causes anxiety. And when you're afraid and you're full of fear, you're not getting proper sleep. You're not getting proper rest. And another thing that's important with a healthy immune system is making sure you get proper sleep. It's recommended to have at least 7 to 8 hours straight of sleep every night. But when you're full of fear and you got your mind thinking about what you saw on the news or heard on CNN or heard about the coronavirus, then you're freaking out. You're full of anxiety. And now that you cannot give your body the proper rest it needs to heal and repair itself. Right. So getting out of fear is very, very imperative so you can get adequate rest. The other thing that I recommend people to do is socialize. Enjoy the relationships that God has given you and placed in your life. Safely, of course. If you have symptoms or you're sick, stay at home by yourself, quarantine. But if you're healthy, go out and enjoy people, because social isolation is not good for anybody. We were designed to be in relationship and fellowship with each other. So social isolation is not good. So I say enjoy life. Live. And not only that, being around other people, you exchanging germs anyway, and it helps boost your immune system. So those are some of the things that I recommend people do. Making sure you're getting your vegetables, your fruit, very, very important as well too. Vitamin D is also very imperative.
There we go.
Especially for African Americans. Majority of us are African Americans. We are, right? But we're vitamin D deficient, because of our melanin, which is what gives our pigmentation. So we're not being able to produce the vitamin D that we get from the sun rays. So vitamin D is very important. There's been a lot of studies, even with coronavirus, that when people who had adequate vitamin D levels, usually at a level of 50 or greater, it actually served as protection for some. And if they did get coronavirus, it was very mild and didn't lead to mortality. So that's great news. They also had some studies where they actually treated people with high doses of vitamin D once they were diagnosed, or another study when they were actually in the hospital. High doses of vitamin D, it significantly started decreasing the viral load of the coronavirus. And those people started turning around rapidly. So vitamin D is very, very important. And I want to say this if I can.
Wait, before you hold, can you hold that thought? And will you
Sure.
remember? Because you said a mouthful there with the vitamin D. You said in the hospital,
yes,
they increased the dosages
yes,
right in the hospital.
right.
So you're saying that even if you contract
Mm-hmm.
COVID, that you can still take the vitamin D.
Oh, most definitely.
Increase. Oh, see,
Most
this is what's not being shared, because
Most
it's a little vitamin. How much profit is there in the vitamin?
Say it again.
How much profit is there in the vitamin?
Oh no, they don't. Big Pharma don't get paid from that.
Okay, so what we have is now when we really start to look at the vitamin D because of our melanated skin. Just recently, I just got my blood work done, and I go outdoors every single morning for at least 30 to 35 minutes, maybe sometimes an hour with my dog. I walk my dog and myself. My vitamin D was 25.
Oh, wow.
And I was shocked. I don't have fluorescent lights in my home. I go outdoors every single day, and I got on an excellent vitamin D supplement. It is called Renew. It has vitamin D. It has vitamin D3, and it also has K2 in it to help transport. Okay. But what is the magic number? So now I'm looking forward to my numbers going up when I go back next month. Been adamant about taking that. And I know that we need somewhere between 50 and 60, because here's what holistic practitioners are understanding. We are understanding that if you have the vitamin D, it's a layer of, not like, it is a layer of protection. And it is the difference between people recovering or not.
Exactly.
I would like to look at those studies of the people who died early on, and I'd like to know what their vitamin D levels are. I don't care what their race is. I want to know what their vitamin D.
They had some studies too that came out, and what they noticed from the studies is that more than 80% of the people who died from coronavirus were vitamin D deficient.
See?
More than 80% were vitamin D deficient. They even had this one study that came out in Italy back when, and that's what kind of got the vitamin D craze going. Because Italy noticed when coronavirus first came out that part of Italy, the people there had adequate vitamin D levels, and there was another part where people were vitamin D deficient. So when the coronavirus attacked Italy, the part that got hit the hardest was the part where people were vitamin D deficient. And they were like, hey, is there a tie here? So that's when they started doing the studies with vitamin D, and they have been fantastic. I mean, published in all types of medical journals, including the Lancet. So it's been really, really amazing.
So I hope that answers the question of App Joe. Where can we get more information about what you were saying? She just said one of the places is the Lancet. Listen, this information is available with the click of the finger.
Yeah.
If you start looking for information like this, you will absolutely find it. It's not hidden, but sometimes they hide it by taking it down. So don't do what I did. If you see something that really is of interest to you, click that link and also copy the article before it's taken down.
Yes.
That's very important, because what we are talking about here is vital, life-saving information, and you should have a good doctor full of notes at this point. Seriously. Don't forget that one of the things too that's highly recommended is this garlic. Yes, this is not prophylactic. This is, if you get the virus, every person in your home should have their own quantity of garlic. It doesn't have to be this brand, but it does need to at least be about these 500 milligrams, at least 425 milligrams. It needs to be that. 12 of these. It's antiviral, antibacterial, antiparasitic. And we've got beta carotene. It needs to be at least 1400 IUs. Do not take beta carotene if you have any liver issue.
Right.
Do not take beta carotene if you have any liver issue. So then you'll take beta carotene and you'll take 16 capsules of these. You'll take 12 garlic. You'll take 16 beta carotene. You'll take them together. Then you will eat. And you know what it does? It overwhelms the virus. It decreases its intensity and the duration of it. Everyone, get this in your home. My technician, Chris, he gave us his testimony. Go back a couple of episodes. He told us that his entire family got on the good foot the minute they found out they were diagnosed with COVID. But the minute you know you don't feel right. But if you're asymptomatic, that could be a problem. And so the minute you get a diagnosis, jump on this protocol, bump up your vitamin D and your vitamin C. This is what I use to replace emergency. No more emergency, y'all. It contains fructose, which attributes to a fatty liver. This is equally effervescent. It's orange flavored. It comes in acai. It comes in lemon lime. Take these, and it also has 200 more milligrams than an emergency. Each packet contains 1,200 milligrams of vitamin C. Bump that up. Like our nurse practitioner said, take your vitamins, go to bed, cancel the fear. You see why I was chasing her down now. This is why I was stalking her. Like-minded, like-spirited, but from another perspective, she comes out of the medical community. What else might you recommend for us to boost our immune systems?
Some good studies been coming out with another supplement called quercetin.
Yes.
Quercetin, the studies have been great. They did what they call in vivo and in vitro studies on those. One on a petri dish and then one they use in animals. But what they noticed is that it significantly decreased the viral load. So then one of the studies, they were actually trying to break it out to see, exactly how. What they noticed that the quercetin was able to block the virus from entering the cells. So that's one element. Another thing they noticed that quercetin also blocked the virus from being able to replicate. So if you're already infected, it can shut down the replication, which can significantly decrease the viral load. The other thing, quercetin is an antioxidant, it's an anti-inflammatory. So the whole cytokine storm, the inflammation that happens when you have the infection, it shuts that down as well. So quercetin is really, really good. It's been shown, even just a small amount, 250 milligrams a day, has been shown great to bring some prophylaxis. They do recommend taking it with the vitamin C, because the vitamin C actually works synergistically with the quercetin and kind of keep the quercetin circulating longer in the system.
Yeah.
You can have it there for a longer period of time to be effective.
And they're not talking about that either.
Of course.
Because quercetin is not something that has been discussed. And when you take that in conjunction with the vitamin D, you base, and it prevents the cytokine storm. Can you explain the cytokine storm?
Cytokine storm is basically an inflammatory response that happens. Inflammation, honestly, acute inflammation is not bad. That's part of the body's immune system to attack something that shouldn't be there. But the issue with the cytokine storm is that the inflammation basically is takes it to a whole nother level. And it's the immune system start getting out of control. And then that's when you start seeing patients who suffer the complications like the respiratory distress or the thrombotic formations like the heart attacks and strokes and other things that we've seen happen, with this coronavirus. So that's why having something like the quercetin on board that shuts down that inflammation is imperative, because you do yourself a good service to basically abort the situation from happening in the beginning.
Yes, and we are going to have a testimony from one of our scientists who contracted COVID himself, but he was taking an anti-inflammatory on a regular basis. It's called Valasta. And when he got to the hospital and they checked his C-reactive protein, his number was only 23. And the doctors were wondering what in the world was he doing? Because your C-reactive protein should be less than 1 or definitely no greater than 3. And the doctor said that they're seeing people come into the hospital with a C-reactive protein level of 200.
Yeah.
And I said, that's because they're already sick. And he said, exactly.
But the interesting thing too, so the quercetin and the vitamin C and the vitamin D through the studies also shown to decrease those inflammatory markers.
Absolutely.
As well too. So those went down significantly with those supplements.
Okay. And this trip to the health food store, you all, this is a little education. Should you want it, it's here. This is what we're here to do to help you attain, maintain, and reclaim your perfect health. That's what it's all about. That's what I'm all about. I want to always be able to present you vital, life saving information because with 400,000 people dead, we can't keep doing what we're doing. It's not the answer. And with millions of vials of vaccine waiting to be injected and maybe even perhaps forced upon you, it's not happening yet. But some people cannot work unless they take the vaccine. What do you recommend to them?
I recommend them to have a relationship with the Lord and seek God's counsel. Because at the end of the day, God is our source and not man. So if you're confronted with a situation where they're trying to force you to do something that is against the will of the Lord for your life, you can, with all confidence, say you respectfully resign and trust God that he will meet all your needs and bless you even above measure.
Amen. Amen. And when there are many people who are going to be confronted with this,
Mm-hmm.
I'm praying for you all.
Mm-hmm.
I'm praying for you who are unable to walk away from a position. And I just urge you to detoxify your body. If you must get that vaccine, if you cannot resign, I want you to detox like crazy. You can grab my book, The Detox Edition Remixed. JG here is asking, do you avoid recommending gems? Jay, I'm about to do a promotion called Workout Right at Home. Workout right at home, y'all. Grab yourself, go to Walmart, grab yourself some barbells. You don't even have to do that. Fill up some water jugs, lift them up. Those are weights. You keep doing that repetitively. I'm telling you, it will eventually start to hurt and you will feel like you're doing something. Weight resistance bands, walk, run. Look, I looked on Facebook Marketplace and I purchased myself a treadmill. And it was so fancy. It was a health club quality. Really, the woman hurt her hip and couldn't use it anymore. And so, yes, and I was so elated. And I paid $200 for this health club quality treadmill that I am so glad to have that I got off of Facebook Marketplace.
Mm-hmm.
Let me tell you something. Invest in yourselves.
Right.
Invest in getting yourselves supplements. Mm-hmm. Invest in some equipment in your home. I personally never did like a gym, even pre-COVID. I think they're nasty. I think they got that same rag. They wiping down stuff. I just don't like the way they smell. I got a germ thing. Excuse me. So to ask that question during this season right now, Jay, yes, my darling, please avoid gyms. Avoid things that you know that there could be droplets. Not only are there respiratory droplets, but there's sweat. Here's a conversation we're not having enough about, Nurse Tamika. We are not having conversations about how COVID is sexually transmitted.
Oh, I have not heard about that.
Oh, well, yes, the droplets, semen, kissing.
Coronavirus, I haven't heard about that because to my understanding, it's more of a respiratory type of thing, through the nose, through the mouth. I haven't heard about sexual transmission of it.
Okay. So my team of scientists who we are still pals from the AIDS days, and they are saying actually that COVID is no different in its communicability in terms of HIV. And I'm like, we're going to have that conversation right here.
Yeah.
Coming up. And they just launched their initiative on Monday, on Martin Luther King Day, which is called the Choose Healthy Life. And if you'd like to go to choosehealthylife.org to check that out and watch their conclave that they had. But that organization and that bevy of scientists is placing that information. Here's the deal. Don't take any chances with people that you're not sure of. That is my recommendation wholeheartedly.
They should be like that all the time anyway. That your general health 101.
There we are. All right. So I spelled the product quercetin. Rose says she resigned from her nursing job when they forced you to take the flu vaccine. Bravo, Rose. I hope that all is well and is right in your financial world as a result of it. But God, we know, is our provider. Good. Peggy says she just phoned in and would suggest that if you have to take care of elderly people with COVID, what do you suggest besides wearing a mask? Peggy, this entire episode will be up in about 2 or 3 hours. It takes a minute to upload. You can go back and you can watch it in its entirety. The nurse practitioner here gave all of the good information, what to do. And right now you're taking vitamin D3 and probiotics. Good. Very good. It's a very good thing to be able to do that. And if anyone else has any questions before we let our nurse practitioner go, she's got to get back to her patients, and so do I. But I just want to thank you. Your final words, Nurse Denise.
For final words, I just want to give you a little bit more information. So that way, when you're faced with a decision or to take or not to take, you can actually make an informed decision. And that piece of information is some of the lead scientists and pioneers of messenger RNA vaccines. When they were interviewed back in 2018, one of their chief safety concerns was that based on how this messenger RNA vaccine worked, it could lead to autoimmunity as well as thrombotic formation. Thrombotic formation is formation of blood clots. Okay, so that's what they said. When you go and look, and you can go and find this information, that was listed in the Nature magazine back in the Nature Journal, my apologies, back in April of 2018. And now if you go and look at the FDA briefing that Moderna did, as well as Pfizer, what you will find out is that people who took the vaccines, and these are the ones that was part of the initial clinical trial, you had some that died. In Moderna's, you actually had someone who did end up getting an autoimmune disease, rheumatoid arthritis. In both of them, you had people who did have a thrombotic formation. People died of heart attacks. Some had strokes. Some had what they call pulmonary embolism, which is a blood clot inside of the lungs. So those chief safety concerns that they were concerned about when they were putting all this together a couple of years ago, we actually see it happening. We see it happening right now. People are also having neurological disorders, other GI disorders, all types of things that's happening that they're not putting out there into the media. So the whole thought is just going to give you some soreness at the injection site, or you may have flu-like symptoms or whatever. It's more to the story than that. So I want you to really take all that into consideration. Why put yourself at risk for those chronic debilitating illnesses when your own immune system can do the job on its own? So really take that into consideration. And really even the fact that they want to withhold treatment that they know works. You don't want to trust anybody injecting anything new into your body that's coming from that standpoint and position.
Okay. Well, last question. What do you say about the inventor of the PCR method?
The PCR is, I don't say anything about the inventor, but what we do know is that these PCR tests are not 100% effective or accurate. So you can't even trust it. And even looking at the numbers too. So you get a lot of false positives. You even get some false negatives. So it's not a trusted thing. And it was never intended to be used for coronavirus diagnosis.
Wow.
So that's another thing about it. And from the other element of looking at the numbers too, they only put before you the almost 400,000 that died. But what they don't tell you is the over 23 million that survived.
Come on.
So based on the number of cases that's happened in America alone, and compared to how many died, only 1.6% of the people died who contracted coronavirus. And even that number is inaccurate because when coronavirus first came out, they weren't even allowing everybody to get tested. So that number is still an inaccurate, miscued number because they were only testing people who had to be hospitalized. And if you didn't have to be hospitalized, you didn't get tested. So once again, that number is even less than that. So more people are living. And African Americans, at least in America, are not getting hit on a disproportionate basis because the majority of people that's dying from coronavirus or the deaths are Caucasians. African Americans, I looked on today as of this morning at 9:10, African Americans only made up 12.2% of the cases and only 15.8% of the deaths, which is almost equivalent to how many, the African Americans make up the population here in America, which is about 13%. Yes. But whites contributed to 61.4% of the deaths. And that numbers continue to go up. So if we look at it, African Americans are not hit disproportionately compared to whites, because the percentage of whites in America is only around 60%. So don't believe that hype that is hitting the Black people and Black communities more than anybody else. That is not true. But they want Black people to get it. And you got to think, why are they pushing it on us so strong? When all you need is some vitamin D, my people. And with it. So I want you just to take all that information into consideration. So at the end of the day, you can make a good, solid, informed decision. God bless you all.
Bless you. Thank you so much for giving us this valuable information from a perspective of a medical practitioner who is also understanding of how we can heal naturally. We appreciate you, my sister. Thank you so much. May God continue to bless you and your good works. That does it for me. To let your eyes shine, cut back on the wine, get good food fast, and go easy on the greasy. Until next week, I'd like to thank my team, IW supervising producer, Chris Green, technical guru, and our moderator, Alicia. Thank you so much for being here. I'll talk to you next week. Take care, same time. Subscribe, share, and comment. God bless you. Hi there. Thank you for joining me. I am at the Essex Culinary Resort and Spa, and I am in a therapy room where you can come and get pampered and get hands laid on you. I had the most amazing massage the other day. It was just totally awesome. Listen, they curate all kinds of things special just for you. Peppermint, hot stone, maple syrup. We are in the land of maple syrup. So won't you join us for the Wellness Warriors Weekend Getaway, June 2021. I'll be here. I want you to be here too. Don't miss it. These are all of the beautiful things on the ceiling at the formal restaurant at the Junction at the Essex Culinary Resort and Spa. Right here, this is the chef's table where you can sit and have an incredible meal. I am here to tell you that the Essex Culinary Resort and Spa has the most amazing restaurants. The food is farm to table, and it is fabulous. So join us for the Wellness Warriors Weekend Getaway in June 2021. Hi there, we are at the outdoor pool at the Essex. Look at this wonderful waterfall. You stand under this, and this is like, oh my gosh, it's exfoliating. Wonderful. What a beautiful poolside to sit at the Essex Culinary Resort and Spa. Don't miss it. We'll be here for the Wellness Warriors Weekend Getaway, June 2021. I'll be here. Join me.